Cervical screening uptake in Sunderland is already pretty great. We have an 80% uptake across the PCNs. However, we're determined to reach the last 20%, which is why Michelle Burgess and I and Wayside Women in Need have teamed up to deliver services to women in refuges directly, from cancer awareness sessions to screenings to HRT, contraception and all those sorts of things. We are here to reduce barriers and break down barriers to deliver the services that are needed.
My name is Caroline Tweedy. I'm the lead cancer nurse and I'm being proud to help and support our project, which is shaped by our patients.
But being part of the project Living with Cancer is not about surviving, it's about thriving, and working as a partnership between the nurses, the oncologists and the team of people who look after us on a daily basis. It hasn't held me back.
From my initial diagnosis of feeling so isolated and no one to turn to, being part of this group has given me so much hope and help to inspire other people that you can move on in life.
From my diagnosis in January that my cancer had come back, that was a negative experience and I thought that was it. But then meeting this group, working on the video and the booklet, it's completely changed my outlook. And I'm hoping that's going to help lots of other people.
Look at me, 97 courses of chemotherapy over the last 8 years, incurable cancer, still working full time and living life.
CDDFT's Veterans and Cancer Information Project aimed to facilitate a reduction in cancer health inequalities for veterans in County Durham and Darlington by providing culturally sensitive, accessible information about cancer screening, early diagnosis and ongoing tailored support in a format that meets their needs. Project outputs included co-production of resources with veterans, development of a Veterans Support Service directory shared across the region, and delivery of armed forces training for healthcare staff.
Hiya, my name is Maureen Elliott and I am the founder and CEO of Live Well with Cancer, a charity which I set up 6 years ago. For the first 4 years I was a volunteer. I did everything in evenings and weekends. During the day I was working as a specialist cancer nurse. It became very evident though that the charity was growing at a pace. So 2 years ago I decided to leave the NHS and concentrate fully on the charity, and it was then that we set up our Live Well hub, community hub, and we've never looked back. Never worked as hard in my life, but I have to say it's been the most rewarding job that I've ever done. So thank you to the amazing community that we serve, to my incredible team. They make Live Well with Cancer what it is. And for whoever did nominate me, it was I'd had an operation that day and woke up to find the nomination. So thank you very much.
Hi, my name is Dr. Ruth Sharrock. I have been extremely fortunate to be able to establish a new programme of work called the Hive Programme at the QE in Gateshead. We've been aware that there are significant challenges facing those patients on a lung cancer diagnostic pathway for some time, and we wanted to embed an offer of enhanced support to all of those referred into the service. Referrals from all sources are contacted within 24 hours and screened for additional needs such as communication difficulties, transport issues, mental ill health, or tobacco, drug or alcohol dependence. And then our Hive support workers can walk the path with our most vulnerable patients, coordinating appointments, arranging transport, creating manageable waiting spaces and considering their holistic needs. Together, we're improving access, experience and outcomes for some of our most vulnerable patients.
Our acute oncology patients continue to get more complex, particularly due to the immunotherapy-related toxicities. A coordinated multidisciplinary approach became essential, so we piloted a virtual MDT with Newcastle back in January, enabling direct communication between NSEC clinicians and oncology teams. There's improved treatment initiation and collaboration, and following that pilot we expanded to the 7 northern hospitals supported by Newcastle Trust. The key benefits have been better information sharing, real-time case discussions, timely specialist input, faster and more efficient patient care, and it's allowed to strengthen links with the Cancer Centre and support the return of the community-based practice.
Our cervical screening video was created to transform how patients receive information, making it clear and accessible. GP practices are using the video as an accountable reminder. What makes it unique is that our practice nurses shape the content, drawing on years of experience and real questions and worries they get from patients every day. The feedback has been very good, with patients reporting greater understanding, reduced anxiety and an increased confidence in attending. To make the information more accessible to everyone, the video is available in 90 languages.
We have added a community physiotherapist and discharge facilitator to our specialist thoracic service. This has enabled us to implement a robust Day 1 discharge programme. We visit patients at home 24 hours post-discharge, again within week 1, and then ongoing weekly visits, essentially moving post-thoracic surgical care from hospital to the patient's home. Increasing our community presence has not only allowed us to visit more frequently and consistently, but enables us to be more reactive to problems. Early data shows we are currently seeing 45% of patients discharged on post-operative Day 1, with a decreasing trend in overall length of stay. Alongside this, patient satisfaction results have been exemplary. As a multidisciplinary team, we work collaboratively with patients to provide a unique service, allowing seamless transition through the whole pathway, giving patients confidence and reassurance that our specialist team will support them.
My name's Alan. I attend the Incurable Cancer Support Group at North Tees. I love attending the group, not just because of the friendships that I've made, but because of the things that we share and that we learn from the guest speakers. These things help me day to day and also going to help me make informed decisions in the future.
Hi, I'm Tammy Dorby and I work for the NCIC as part of the lung cancer screening team covering the whole of the North Cumbria. I have been with the team for 3 years, but only in the last year have I been heavily involved in the setting up of the lung cancer screening team. I'm delighted and overwhelmed to be nominated for the award Going the Extra Mile. However, for me, I feel that this is part of my role to make sure that patients get a first-class service. Personally, I feel like it's been a team effort into planning and delivering this programme together. We make sure that our system is patient-centred, taking into account obstacles that make it difficult for patients to attend and engage with screening programmes. We try to focus as much as possible on making the pathway as efficient and as smooth for patients. We really feel that we are making a difference in detecting lung cancer early, and I'm extremely proud to be part of the team. Thank you for the nomination. I'm really humbled.
The cancer rehabilitation leads have demonstrated improved patient experience and treatment outcomes through their collaborative approach to service design and implementation. Representing 7 of our trusts, this multidisciplinary group comprising of physios, occupational therapists and dietitians have come together to create a dynamic community of practice that has helped shape our cancer prehab strategy. The leads have been pivotal in embedding prehab within our cancer pathways and have started to consider how we can standardise services, including referral forms and triage tools, helping to ensure equitable access and care for all our patients.
Hi, my name's Corey. I'm 27 years old. All of the teenage and young adult patients will be offered genomic testing as part of the introductory process with biopsies, etc. It's brilliant that it's happening now, but it is something that I would have loved to have been involved in had it been offered to me. Can I go?